At the end of the day, like if you follow the money, you can actually find the answer, like what's really going on. So where does each dollar go? And I just kind of dug deeper and deeper. Okay, pharmacy makes maybe like the processing fee. PBM makes clawback, makes like rebates. And then insurance company, depends on how they set up, they may also get some rebate, but most of the time, the PBMs are the one that's making money. So I follow the money, and that's kind of how I eventually learned the system.
Welcome to How I Doctor, where we're bringing the joy back to medicine. Today, I have the privilege of talking with Dr. Simon Chang, a hospitalist and the CEO and co-founder of eNavvi. Thank you so much for joining me today, Dr. Simon Chang.
Thanks, Ren. Thanks for having me. I'm really looking forward to our discussion today.
Simon, let's dive right in. You're a DO. You finished residency in 2022, and you were an intern when COVID hit?
Yeah, my first year was in Long Island, New York, where COVID hit around March. So I saw like the wave of COVID from New York City.
Simon, when did you decide, hey, I think I want to make a company?
I feel like I've always been an entrepreneur a little bit, like when I was younger, like selling collectible cards to like just later on in life, like doing all types of random stuff. Like I like the creative part of the business. And so when I was in med school, I've known that there are things that I want to do beyond just clinical medicine.
So as a kid, you were selling baseball cards or Magic the Gathering or Pokemon, or what were you selling?
Magic the Gathering, Yu-Gi-Oh cards. So like, okay, like I did figure out one thing early on that like kind of made me a lot of money as a kid. I was kind of hustling as a kid, like
Hustling at 12.
Hustling at 12, watching for like little things that people don't notice and kind of leaning on it a little bit to figure out, okay, did this work?
So Simon, yeah, obviously a big difference between hustling Yu-Gi-Oh cards and deciding to do something in healthcare. I think a lot of physician entrepreneurs obviously focus on healthcare because that's what we know. But tell the listeners a little bit about eNavvi and where you came up with the idea, because certainly a pharmacy or pharmaceutical guide is probably not top of mind for most doctors.
So I think like every doctor, if you ask any doctor in the country, like, have you seen a patient that got turned away from the pharmacy or couldn't afford their medication and ended up in the hospital? I feel like every doctor will say yes, they encountered that. I had the opportunity to go study abroad before I entered medical school. I wanted to take a year to figure out like, okay, what path do I want to go down? I want to have a career that's impactful and really like love like solving problems in the healthcare field. But I wasn't sure like research or being a clinician would be the way to go about it. I learned that like in most European country, most developed European country, no patient gets turned away from the pharmacy because a drug's too expensive or not covered. If we know every doctor in the country in the US knows someone that ended up in the hospital because of not knowing what drugs cover, and in other countries where no one gets turned away and no one ends up in the hospital because a drug is not affordable or not covered. So what can I do to like tackle some of these low hanging fruits in healthcare?
I think probably all of us have seen a diabetic who, ran out of insulin, or they were like trying to, spread out their insulin, or they couldn't get their glipizide or their metformin or whatever, and ended up in the hospital. Probably every single doctor has seen that, because diabetes just leads to so many other bad problems. And then how did you decide? I mean, the pharmaceutical industry and PBMs and this whole system is extremely complex. I get zero training or understanding of how pharmaceutical benefits and PBMs and what a copay is. Like that seems also like a really big area to decide, oh yeah, I'll tackle this.
Yeah, it's like a black box. I think every doctor knows there's a problem with PBMs, but like, what can we do about it? If we don't know how they work, we can't really figure out how to get rid of them or how to work with them. The PBM industry and insurance companies, they're all basically control how doctors practice medicine nowadays. So it honestly like just took a lot of learning on my own, like after years about reading, just following through, just trying to understand the whole system, building, getting formulary, where do they come from, who sets up the formulary, does the insurance company set it up, or PBM set it up, and who's making money. Like at the end of the day, like if you follow the money, you can actually find the answer, like what's really going on. So that's kind of what I did. I followed the money of prescription drugs. Where does each dollar go? And I just kind of dug deeper and deeper. Okay, pharmacy makes maybe like the processing fee. PBM makes clawback rebates. And then insurance company, depends on how they set up, they may also get some rebate. But most of the time, the PBMs are the one that's making money. So I followed the money, and that's kind of how I eventually learned the system.
This is becoming a common theme. You have to understand all the painful detail of like how the healthcare system works if you want to address it and fix it. And ultimately, we physicians are the ones that are seeing all the challenges in the system and the impacts on human beings, on actual patients. So Simon, tell our listeners what exactly eNavvi is and how it solves the problem that you identified.
So eNavvi, it's a end-to-end prescription support platform for doctors. So we kind of built like three products. The first one we did was Formulary Navigator, where we was able to gather like Medicare, Medicaid, and marketplace plans, and put it up in a website where physician could go on and just select the plan that the patient has and figure out what drugs is covered, what's a copay, what's a cover alternative. That product was incomplete because PBMs didn't want to release like private insurance plans formulary and costs. So I couldn't finish that product.
So you're trying to build a product that helps a doctor figure out what medication is cost effective and is not going to bankrupt the patient. And you couldn't complete the product because the PBMs wouldn't tell you what's on formulary, aka what's cheaper for the patient and the insurer and everybody.
Yeah. A lot of people get their insurance through work. So like a lot of insurance are actually like employment based. And employers go through a broker, and the broker may work with the PBM, work with the insurance company, and then they may try to figure out, okay, what do we want to cover for the formulary? And they don't want to share that information publicly. So learning that point made me pivot to a cash price marketplace, where we just go by cash price medication. You know how much it's going to cost. You can look it up on our platform, kind of like GoodRx, but we add an extra step on top of that where we can e-prescribe. So you know the price as a physician, you can send it in and don't worry about it afterwards.
So I'm a physician. I've got an NPI number and a DEA number and whatever. I can go on to eNavvi, make an account. I guess I get verified, and then I could actually prescribe lisinopril to you via e-prescribe via your platform.
Yes, that is the goal of the product. What eNavvi is trying to do first is to give physicians back their autonomy to practice medicine wherever they go. So ability to e-prescribe anywhere on a phone, on a laptop, outside of work, and then we allow you to send prescription to our partner pharmacy. And our partner pharmacy are pharmacy who give us their price. So what we're different, it's the insurance group is that every pharmacy that's listed on our site have price transparency.
Ever feel like everyone else in healthcare is making money hand over fist, while doctors are the ones always getting pay cuts? That's where Offcall comes in. At Offcall, we're helping doctors take back control of medicine. The next time you're asked to see more patients in less time, or forced to submit yet another prior authorization for your patients, Offcall is here to help. Visit offcall.com and sign up today to join a community that's putting doctors back in control of their careers.
So you finished residency. How did you decide, okay, I'm going to do eNavvi time full time and I'll maybe work some, I know you work as a hospitalist kind of on the side. How did you decide, okay, I'm going to do my startup as my main thing and do medicine as my side gig versus the other way around?
I don't know if it was hard because like I kind of knew I wanted to give eNavvi a try. So I do think like one of the benefits of being a physician is that there's no shortage of clinical work. Can I work enough as a hospitalist and then give me enough time off to also work on my startup? First, I was working like 10 to 14 days a month as a hospitalist, and then rest of the time my startup. And for the first 2 years after I was doing residency, I was slowly like seeing, okay, how much progress do we make? Are we on the right track? And then is the product growing? And it wasn't until like the second year where I saw it was clear that okay, there is traction, there is a need. People do want to use this, and then we were able to get an angel investor. So that also kind of helped me. Okay, we are on the right track now. The benefit of being a physician is that like I can support myself financially while building my company. I don't have to take money if I don't have to, and I can keep on building the product the way I would like it to work for our colleagues. How many shifts do I need to do to support myself, and then also give myself enough time to work on my startup? So eventually, I landed at like 7 days a month as a clinician, and the rest of the time my startup. That's my ideal setup.
I think that is a key point that you just said. You were able to use the money that you're earning from practicing medicine to support your ability to be an entrepreneur. And you were, it sounds like to some degree, able to pilot eNavvi or start to build it for a year and then figure out, hey, does this have legs? Am I going to like take a bigger risk?
Exactly. I mean, I love practicing medicine as well. I do love helping people. And if I fail, my fallback is going back to practicing medicine full time. That's not such a bad thing to me.
Simon, do you find that your clinical practice now still informs either what you build or your opinions or your vision for eNavvi?
Oh, for sure. To solve problem in healthcare, you have to understand like how it works, how clinicians work, like how much stuff we have to do. And now, like I'm working as a telehospitalist, so we're doing acute care for patients that are not too sick to be at home. And then with that, like I was able to see, okay, how do we bring equipment to the patient's home? How to bring medication to the patient's home? You get to see the innovation that's happening. You get to see, you get to like see people try new things and learn about like, okay, what's working, what's not working. Healthcare is just super complex.
I think a lot of people outside of healthcare expect that the rules would just kind of make sense. Do you get the sense that this entrepreneurial spirit or this interest in doing something outside of kind of quote unquote just clinical medicine, is this a Simon thing or is this a generational thing? Do you get a sense that this is something that your generation of physicians want out of their career?
I do think that my generation was a generation that was raised under the idea that you can do whatever you want. So I do think my generation is more hopeful in terms of like trying to solve problems. But I think like there's one thing to have ideas, but then the other thing to execute.
And you're right. You do have to have confidence in your vision and your belief that this is a problem worth solving and that your company has a good solution to the problem as well. Tell me a little bit about your decision to get an angel investor, to get some crowdfunding. How did you decide that's the way I'm going to help to support this business?
For me, building a product for physicians, like constantly I'm talking to my colleagues because I have access to physicians. So for the past like past 4 years, I've asked enough physicians for feedback. And there's a lot of people who's like, hey, if you want when you're raising money, let me know. I'll invest. Because like if you like most doctors talk about like investment, like what stocks they're buying or like what real estate they're investing, like everyone talks about investment. So knowing that part and having like people tell me along the way, hey, once it's up and running, like if you need investors, let me know. So I wanted to like test it. Like, hey, okay, if I'm building a product for my end users, would they put money behind it? Even they're saying they would they actually do it? So it turns out like about 70% of the investors so far are physicians, and we're growing, and they're sharing with their friends. So it kind of like validated the idea. Okay, yes, doctors will put money behind something they think will be useful. So crowdfunding was a great way to test that.
Simon, let me ask you. I know you have a partnership with Mark Cuban's Cost Plus Drugs. Tell me about how that partnership came to be.
It was about, I guess, a year and a half ago where we were connected with one of their VP of business development at Cost Plus Drugs. Like we showed them, hey, we're doing this insurance thing where we showed the copay, but you guys have this cash price available. And sometimes, like some medications are cheaper to pay with cash than copay. So can we partner together where I will list your medications on our site, and if it's cheaper than copay, then maybe patients can go to you to get the medications. Their vision of like this cost plus model and driving transparency, it aligns with what eNavvi is trying to do. So it was kind of, I mean, when we reached out to them, it was kind of like, okay, we're both trying to make healthcare better. We're both are tired of like this lack of transparency in costs. So let's work together. And it was kind of slowly where we worked with them to get their cost plus pharmacy medication on our platform. And now we expanded to Team Cuban card, which is kind of like a PBM coupon code where you can pick up medication at your local pharmacy.
So I can go on to eNavvi and I say my patient has high blood pressure, and I can essentially find I want to use lisinopril or Norvasc, whatever it is. I can type that into eNavvi, and one of my options will be Cost Plus Drugs for the lowest cost for
Mhm.
whatever 30 days of 5 milligrams of lisinopril.
Yes, yes. And we're in the process of getting single care, which is kind of like GoodRx on board. So that will allow us to offer like basically all the medications and to even CVS, Walgreens, and Walmart. So our footprint will really expand.
What other things have you learned along this journey?
So talk to your users, like talk to your users early on, and not don't listen to just one user. Get enough feedback to know like what the real problem is. If you are trying to build something, get an MVP, talk to the end users, talk to a lot of end users to figure out like if what you're building actually works. I do think like focusing on user experience, user design, especially in healthcare, can get you far because at the end of the day, like, come on, like all of us try to like change things in Epic to make it better. I think doctors try to point out issues, but a lot of us, like, our feedback are rarely like taken into consideration when they're building these tools. So if you take that into consideration first and build a tool for doctors, then I think you have a better chance of succeeding.
So physicians are obviously really busy people. How have you gotten physicians to give you feedback?
If I ask you to do a favor for me to check it out, like you say you want to do it, but are you going to actually do it that day? Probably not. Not because you don't want to do it, because you really are just too busy. So you really just have to like follow with them and like just find a time to really, well, asking once is not enough. Like even though they say yes, follow up with them. I do think like if you're a physician yourself, you get more credit. People will do more for you versus a non-physician. So I think that's our advantage where we are doctors, so other doctors will give us a courtesy, but you just have to try and be persistent. Finding a champion too. Finding a champion that like really believe in your cause and maybe they can ask around, that can also go pretty far as well.
Simon, let me wrap up here with we've got some kind of rapid fire questions. What do you wish your colleagues, maybe outside of hospital medicine, other specialties, what do you wish that they knew about what it's like being a hospitalist?
I feel like sometimes hospitalists has been used as a dumping ground for for other specialty where they don't want to take care of the patients. And they will actually like find excuses like, oh, this patient had diabetes. So like we're not gonna take this patient on our service. Well, but like end of the day, like we're all working together. Like, yes, like we're gonna take care of the patients regardless, but sometimes like consult us, like don't we're a team. Like we're happy to work with you, but don't dump on us. Don't punt.
Don't just
Don't
punt.
punt. Yeah.
Yeah, don't dump. Yeah. What's something you didn't learn in medical school but is crucial to your daily practice?
In med school, we talk about communication skills, but it's different where in a real work environment, there's tension, there's history, there's different things, and like different people have different ways of communicating. So like learning how to like deal with different personalities and learning like figure out like what each person cares about and how to make everyone work cohesively in the team. Like those are like soft skills I feel like you learn throughout life. Where if you like, I don't know, played a sport, you work at different jobs. Like there are a lot of these like soft skills working in teams where you don't really get that in med school.
Simon, what's the most ridiculous thing you've gotten dinged for in in residency or as a hospitalist?
Yeah, so I got dinged for it because I chose the antibiotic duration for 10 days instead of 14 days.
Who dinged you for that? ID or a pharmacy or
No, like a different hospitalist dinged me for it after they took over my care. And then basically, like, I had to provide the most up to date guideline, which I did, like 14 days with a negative procal. It's sorry, 10 days, and with the downtrending procal that normalized after 5 days. That's enough to stop. But older doctors, they, it just like medicine, you practice medicine how you've been trained. So if you're always doing 14 days, someone does 10 days, you're like, oh, that's not enough. But like the new guideline, new practices, new study shows that you can shorten duration based on like some data. So I got dinged for that, but I think I got a P0 for it. So not really a ding, but it's all good.
Simon, do you have a lesson from a mentor or an attending in medicine that still shapes the way you talk to patients or think about heart failure or how you practice as a physician?
You cannot teach passion. Like you can teach people how to do not like learn knowledge, but like passion is what gonna make that person wake up every day and do their job. So if you want to like work with people, hiring people, find people with passion about the thing they're doing, like about the job. So having eight players on your team, you can go way further than someone that will be only do what they're told to do. So it's about finding the passionate people to work with you.
Simon, where can listeners find you and your work and support the work that you're doing?
Yeah, they can find us on eNavvi.com, eNavvi, where you can sign up, see what we're doing. We'll update users at the end of the day. Like, we're building a tool for physicians. So if any physician want to reach out to me, they can find me on LinkedIn.
Amazing. Thank you, Simon. Again, I really appreciate you taking the time today from your practice and look forward to seeing more what eNavvi's up to in the future.
Thanks, Ram. Really appreciate you having me.
Thanks for joining me today. For interviews with physicians creating meaningful change, check out offcall.com/podcast. Make an account on Offcall to confidentially share your details about your work and sign up for our newsletter where you can hear more about the latest trends we're seeing in physician pay. You can find How I Doctor on Apple, Spotify, or wherever you listen to podcasts. We'll have new episodes weekly. This has been and continues to be Dr. Graham Walker. Stay well, stay inspired, and practice with purpose.